My name is Leora Mogilner, and I am Director of Reach Out and Read at Mount Sinai. I'm a practicing pediatrician, and I am an assistant professor of pediatrics in the Mount Sinai Medical Center. We started Reach Out and Read at Mount Sinai in 1997 to address some serious needs we saw in our patient population. While we could address our patients' medical needs, we realized that we weren't doing as great a job addressing their developmental needs. And when we delved into it, we realized that for many, if not most of our patients, they didn't have a culture of books and reading in their home. So when we heard about Reach Out and Read, we thought this would be the perfect program to bring to our institution. The overwhelming majority of our patients are on Medicaid and on public assistance. Many of the families don't speak English as a first language, and most of the parents said they were not read to when they were children. Having Reach Out and Read in our practice has informed the way that we interact with families. We come into the room, we bring a book. When a child is screaming and crying, we give them a book, and it allows us to use the book and the parent-child interaction around the book to determine how the child is doing from a developmental perspective. Having this print-rich environment and having books everywhere really sets the tone and the culture of our practice. As a mother, and I have 4 children, I personally know how incredibly rewarding it is to read with your children.
Well, basically, I feel that the actual program is very important because every kid will have an equal opportunity to be able to learn how to read, and then they'll see that reading is actually enjoyable, and they'll be motivated to further their education and go to college and build a successful life. I feel that the Reach Out and Read program is a great program because it's the foundation for success.
Reach Out and Read program, I think, is so special for us and for our family and my kids, because they help my kids explore the world, through the books, and to grow up more educated when they go to the school. And I think for the future, it's going to be a wonderful thing. If we stop reading, we stop dreaming.
When I see patients who've grown up in difficult circumstances, whose families had limited means and limited resources, and I see that they've thrived and flourished, and they've done so well, and I'd like to think that Reach Out and Read has something to do with that. It makes me incredibly proud and just so happy to know that by changing their home environment and by teaching them how important it is to have books in your home and to read with your children, they've actually made this difference in their lives. I feel really great.